It's early morning. The room is quiet. No alarm yet. You wake up before the day starts and, without thinking, you check in with your body. Not with words. Just a feeling. Something is missing. Not pain. Not sickness. Just a quiet absence of strength you used to expect when you opened your eyes. For many men over 50, this moment is unsettling. Because it raises a question most men never say out loud. Is this just age, or is my body starting to slip? Here's what most men don't realize. In many cases, this has little to do with desire, effort, or masculinity, and almost nothing to do with willpower. It often comes down to one simple thing happening every night, without you noticing. The way you sleep is quietly interfering with your body's ability to recover. And if recovery breaks at night, confidence fades in the morning. I am Dr. Claire Monroe, a urologist with over 14 years of experience helping men over 50 restore sleep, circulation, and confidence naturally and safely. Before we go any further, I want to slow this down for just a moment. What you're about to hear is not a diagnosis. It's not a prescription. And it's not a promise of instant results. This is education. Everything I'm sharing comes from basic sleep biology, circulation science, and patterns I've seen repeatedly in men over 50, supported by research from places like Harvard, NIH, Johns Hopkins, and the American Urological Association. Now, here's why this matters. Most men think problems with energy, stability, or bedroom confidence start during intimacy. They don't. They start hours earlier. They start at night. They start when your body is supposed to shut down, relax, restore blood flow, reset nerves, and repair tissue. And if that repair process is interrupted night after night, your body doesn't fail dramatically. It fades quietly. You don't wake up broken. You wake up a little less solid than before. What you'll learn today is very specific. You'll see the sleep positions that look harmless but quietly strain your spine, restrict breathing, and keep your nervous system on edge. You'll also learn better positions that give your body room to breathe, relax, and actually recover while you sleep. Nothing extreme. Nothing athletic. Nothing that requires flexibility or special equipment. Just small changes that remove pressure instead of adding more. If you're expecting a miracle trick, this isn't it. But if you're willing to understand how your body works at night, you'll start seeing why so many men notice changes in just a few weeks. Not because they forced anything, but because they finally stopped working against their own biology. All right, let's talk about the positions that quietly cause the most damage first. Let me be direct with you now. Most men are not sleeping wrong because they're careless. They're sleeping wrong because no one ever explained how much position matters after 50. You lie down, you get comfortable, you fall asleep, and you assume your body will take care of the rest. But certain positions quietly place pressure in the exact areas your body needs relaxed in order to recover. Over time, that pressure adds up. The first one I see all the time is sleeping flat on your stomach. A lot of men do this because it feels grounding, especially if you've had back pain in the past. But when you sleep face down, your spine is twisted for hours. Your neck is turned to one side. Your hips are rotated inward. That tension runs straight through your lower back and into the pelvic area. And here's what most men don't realize. The pelvic region is not just muscles and bones. It's nerves. It's blood vessels. It's communication lines between your brain and the rest of your body. When those areas stay compressed all night, your nervous system never fully relaxes. So instead of deep, restorative sleep, your body stays half alert. You may not remember waking up, but your brain does. Men who sleep this way often tell me the same things. I wake up stiff. I feel irritated for no reason. I'm tired even after 7 or 8 hours. I get up to use the bathroom more than I used to. This isn't random. It's the position. The second position is what I call the tight side curl. Knees pulled up, back rounded, shoulders collapsed forward. It feels safe, almost comforting. But comfort is not the same as recovery. When you curl tightly, you compress your abdomen and chest. That limits how deeply you can breathe. Shallow breathing keeps your nervous system in a mild stress state, and a stressed nervous system does not allow full repair. Instead of drifting into long, steady phases of deep sleep, your body keeps popping up toward the surface. Not enough to wake you fully, but enough to interrupt the process. Men who sleep like this often wake with a tight neck, a sore shoulder, a feeling like their body is already tired before the day starts. Over months and years, this constant low-grade tension erodes stability and confidence. Not suddenly, quietly. The third position is sleeping on your back with no support. Now, back sleeping can be excellent, but only if it's done correctly. When you lie flat with no support under your knees, many men develop an exaggerated arch in the lower back. That arch keeps the muscles engaged all night. Muscles that never fully relax prevent deep sleep. This position also tends to worsen snoring. And snoring is not just noise. It's a sign that airflow is restricted. Restricted airflow lowers oxygen levels. Lower oxygen interrupts the deepest sleep stages. And without those stages, your body cannot properly reset circulation or nerve signaling. Men who sleep this way often say, "I slept, but I don't feel rested. My head feels foggy. My mouth is dry in the morning." Again, not age. Position. The fourth position is subtle, and almost no one talks about it. One leg bent, one leg straight. It feels casual, almost accidental, but it twists the pelvis for hours. A twisted pelvis pulls on the lower back. It tightens the hip flexors. It irritates nerves that pass through that region. The result is imbalance. Men wake up feeling uneven, one side tighter than the other, less stable when they stand. And stability matters, because when your body feels unstable, your mind follows. You don't feel broken. You just don't feel solid. That's how these positions work. They don't create dramatic symptoms overnight. They quietly steal recovery night after night. And before you even realize what's happening, mornings feel different than they used to. Before we talk about how to fix this, let me ask you something honestly. Which one of these sounds most like the way you sleep right now? Because awareness is the first step. And once you see it, you can change it. Now, let's move on to the most important part. It's not about the perfect position. It's about the position that allows the foundation to truly relax. After age 50, the foundation doesn't need to be compressed. It needs to be decompressed. This is the first thing I usually recommend, and also the easiest to apply, lying on your side with a pillow between two other pillows. It sounds simple, but its impact is significant. When both knees are supported, the pelvis is no longer twisted. The lower spine is held naturally. The surrounding deep foundations and hips have a comfortable base. And when these foundations relax, the nervous system receives a signal of safety. That signal doesn't say, "No more need to be vigilant." It's that deep sleep begins to occur more frequently. The method is very clear, lying on your side. Place a pillow between your knees. Don't curl your knees up too high. Don't roll them up. Maintain the stacked position. Don't move forward. You don't need to feel exceptionally comfortable right away. You just need to feel less tension. The second position is lying on your back, but with support. Many men lie incorrectly. They complete it. No head pillow. The support below is reinforced throughout the night. That contains the always active base. The active base will not be able to recover. Just a small brace placed under the knees, reducing the sharpness to a minimum. When the lower part is relaxed, breathing slows down. When breathing slows down, sleep goes into deeper layers. If you stand up many times, don't try to endure it. Breathing is more important than that. In that case, upgrade to or switch to side support. The third position is the slightly supported side-lying position. This is a great option for those who don't like lying completely on their side. You start lying on your back. Then place a support behind you to be able to tilt about 20 to 30 degrees. Don't excitedly turn to the side. Don't finish. This helpful advice reduces pressure on the lower body, reduces the chassis, provides better respiratory support for many people. Many men tell me this is the first position they can maintain all night without sleeping due to pain or discomfort. And importantly, this is it. When the base can't support itself, it can't file to recovery. Recovery isn't just about sleeping. Recovery is better blood circulation, more stable nerve signals, less stress on the system. And all of that directly affects how you feel in the morning. Not overnight, But over several weeks, many men realize they wake up less tired, feeling less joint pain, feeling less betrayed by their core. They don't do anything disgusting. It's because they're constantly causing harm while they sleep. Let's pause here for a moment, because at this point, many men start to realize something uncomfortable but important. Nothing dramatic was wrong with their body. Nothing suddenly broke. Their body was simply never given the chance to recover at night. When sleep is shallow, twisted, tense, or interrupted, the body goes into maintenance mode instead of repair mode. It keeps you functioning, but it stops rebuilding. And over time, that shows up as less energy, less stability, and less confidence when you wake up. So instead of trying to remember every detail, I want you to think about this in a very simple way. For the next 7 days, your only job is to remove pressure, not to force change, not to stretch aggressively, not to fix yourself. Just remove the things that quietly keep your body alert at night. The first night, you simply notice how you usually sleep. You don't judge it. You just become aware of it. The second night, you add support. A pillow between the knees if you're on your side, or under the knees if you're on your back. The third night, if you wake up and catch yourself curling tight or twisting, you gently reset your position instead of fighting it. The fourth night, you commit to one supported position for as long as your body tolerates it, even if it's not the entire night. The fifth night, you make your bedroom calmer, darker, quieter, less stimulation. The sixth night, you stop screens earlier than usual, not because screens are evil, but because your nervous system needs a clear signal that the day is over. And by the seventh night, you choose the position that felt the least stressful on your body and repeat it. That's it. No perfection. No pressure. Now let me tell you about a man I'll call Michael. Michael was 61, healthy on paper, still working, still active. But he told me something very specific. I don't feel weak, he said. I just don't feel steady anymore. Mornings felt flat, sleep felt light, and confidence felt fragile. We didn't change his diet. We didn't add supplements. We changed 2 things. He stopped sleeping on his stomach, and he added a pillow between his knees when he slept on his side. That was it. 2 weeks later, he told me his mornings felt different. Not dramatic, just calmer. His body felt more cooperative, more predictable. And that steadiness changed how he moved through his day. That's how recovery usually returns. Quietly, gradually, but clearly. So here's the question I want you to think about honestly. Which position do you fall into most nights without even realizing it? Because once you see it, you can start choosing differently. And that choice is where change begins. If you want to remember this reset, comment the word checklist below so it stays on your mind. And now let's finish this properly, because what you do next matters just as much as what you learned today. Now let's close this out in a way that's actually useful. If you remember nothing else from today, remember this. Your nights shape your mornings. And for men over 50, sleep is not just rest. Sleep is when your body restores circulation. Sleep is when your nervous system resets. Sleep is when your tissues get oxygen and recovery signals. When your sleep position keeps your body tense, twisted, or struggling to breathe, your body cannot do its job. So here's what you're taking with you. For positions that often sabotage recovery: stomach sleeping, tight curling on your side, flat back sleeping with no support, and the twisted pelvis position with one leg bent and one leg straight. And 3 better choices that help your body recover: side sleeping with a pillow between the knees, back sleeping with a pillow under the knees, and a gentle 30-degree supported tilt if you hate full side sleeping. This is not about being perfect. It's about removing pressure so your biology can work again. Now, if you want the simple 7-day reset plan, do this right now. Comment checklist below. Then hit like, because it helps other men over 50 find this kind of calm, practical health guidance. And if you know one man who's quietly struggling, tired mornings, low steadiness, less confidence, share this with him. He may never ask for help, but he will watch a video. And finally, subscribe and turn on notifications, because we're building this step by step. Now here's the next video I want you to watch in this series: Men Over 50, 5 Nighttime Bathroom Mistakes That Quietly Destroy Sleep and Prostate Comfort. Because even if your sleep position improves, certain evening habits can still wake you up, fragment deep sleep, and keep your body from fully restoring. In the next video, I'll show you the most common mistakes men make after dinner, small things that seem harmless, but can lead to more night waking and less recovery. It connects perfectly with what you learned today. Same goal: calmer nights, stronger mornings, more steady confidence. And as we finish, I want to say this clearly as your doctor: you are not broken. You are not past your prime. You are a man whose body needs better conditions to recover. This video is for educational purposes only and is not medical advice. Always talk to your own doctor or urologist about your personal health. I'm Dr. Claire Monroe. Take care of your SLE and your future self will thank you.